Here's the record. 0.
Well, hello, everyone. This is Randi Mann from Wise Woman Wellness, and I'm so excited to be interviewing Dr. Daryl Turner today. You know, I have known him since I think 2013. I met him in Florida at an age management conference, and he basically blew me away with his knowledge about thyroid and what he has developed, his protocols and his ThyroFlex machine to help us figure out what's going on, especially when we have a lot of symptoms for a patient and the labs don't seem to help us. So anyway, I'm excited to go through some information with him. I'm going to ask him a few questions and let him give us a ton of answers. So Dr. Turner, tell us about thyroid, please.
Well, thyroid is like the central railway station of your entire body. In other words, it controls how you feel, the quality of your life, and how well your life is going to proceed for the rest of your life. According to Broder Barnes and Dr. Terry Hertog, they postulated in their books that 80% of everyone has a thyroid condition, but it's not always picked up. In fact, we've had our testing devices and our systems on the market for 21 years, and we have about 1,000 centers around the world that test for thyroid, and all my doctors report back to me that it is about 8 out of every 10 patients have a thyroid disorder. Why is it missed? Well, the blood tests, the standardized blood tests, are not valid. According to Dr. Bayliss, or Sir Dr. Bayliss, the endocrinologist of the royal family in England, the head of the Endocrinology Society at the Lister Hospital in London, and of course, the head of the Endocrinology Society in Europe, he stated a few years ago that none, that's N-O-N-E, of any of the blood tests for thyroid are valid. In fact, he went on to say that only symptoms and reflexes are the only way you can get a valid indication of thyroid function. And that's what we're going to talk about today.
And I can tell you in my practice, I would agree with that. I would say a great majority of my patients do have thyroid problems, whether they were aware of it or not.
Yes.
Thanks to your teachings and your ThyroFlex machine, Dr. Turner. Okay, so would you go over some of the symptoms of hypothyroidism for us, please?
Sure. It's fairly easy to pick up. I mean, I meet a lot of people at the time. As soon as I shake their hands, if they have cold hands, I know there's a probability of them having a thyroid issue. Why? Because thyroid controls the resting metabolic rate in your body. That is how many calories per day that you burn. And of course, it controls your basal temperature. Low basal temperature, you have a thyroid issue. So cold hands, cold feet, and cold tip of the nose is indicative of thyroid. But thyroid really plays havoc with the brain as well, because besides not having enough blood supply to the feet, hands, and the nose, you don't have enough blood supply to the outer portion of your brain. So you get slower thinking, you get more depressed, or the mood changes more easily. You may have been not as good at math as what you'd hoped for your entire life. Your memory's not as good. You think that you're clumsy because you're bumping into things all the time. It's not. It is your thyroid, because a person who has thyroid cannot walk in a straight line. They walk to the left or to the right. You can get a slight tremor. That is the start of the Alzheimer's and the Parkinson's-like diseases from low thyroid function. If it goes on for years and years and years, that increases. But for the menstruating females in your practice, Dr. Mann, we have menstrual problems. In other words, your periods are not exactly 28 days. You get clotting, and you get pain, and your period may last for more than three days. If it was any of those, that is not normal. And finally, you're always getting tired and lethargic. There's a whole list of other symptoms, but that's the main ones. Your patients come in tired, lethargic. They want to get on with their lives, but they just can't. They just don't have the energy.
That's for sure. It really is an unhappy person when they have a thyroid problem. They
Yes.
really are. It's really fun actually to do this kind of practice because we can really help diagnose properly and treat patients properly, and we can get people so much better thanks to you.
Change the quality of their life.
Exactly. Well, please tell us about the Thyroflex machine and the Thyroflex test.
Okay, the Thyroflex machine, as Dr. Bayless recommended, not only do you fill out a symptom sheet, but we look at the speed of your reflexes. All the reflexes in your body all have the same response. You cannot control them. The biggest reflex muscle in your body is your heart, and that is controlled by your thyroid. In other words, if your thyroid is low, you have a slow heartbeat. If your thyroid is overactive, you have a fast heartbeat. That's very well established fact. So I went ahead and I developed a thing called a Thyroflex machine. The Thyroflex machine tests the speed of your reflexes. And when I hit a very specific spot called the brachial radialis, I induce a reflex that goes to the brain and it comes back again. The Thyroflex tests, and oh, by the way, every doctor learns that the reflexes speed up and slows down in medical school. They cover it in about 10 seconds, but we all learn that, right? But we measure a neurotransmitter speed, the speed at which your brain is working. We measure a thing called a resting metabolic rate. That's how many calories you're burning per day. In other words, thyroid does control your weight. Those 3 spare tires around your middle are not your fault, right? And as they keep on growing bigger and bigger every year, it's because the thyroid is not burning enough calories, and that's what we measure. A person with thyroid is usually about 400 calories too low, and then we test the speed of the reflexes. In other words, how long it takes your hand to come up and down from a reflex response. So this is hypothyroid, this is hypothyroid, and this is euthyroid. So it's a very definitive test that's 98.5% accurate. I did clinical trials on 2,200 people over 3 years, and we tracked them, and we are FDA approved, CE approved, TGA approved, etc. We have all the approvals around the world. We have the machines in 28 different countries with about 1,000 clinics and hospitals around the world. And as you do, Dr. Mann, we find that you eventually cannot do without your Thyroflex machine in making your patients happy. It's a 4-minute test.
Okay. And just for people that here in the United States, what does TGA and CE mean? We know, but I think most people here know what FDA is, but how about the other two?
TGA is Therapeutic Goods Authority that covers all the Pacific, Asia, and then CE is Europe, the European.
Okay.
So they're the equivalents of the FDA.
Thank you. Okay, so what you're telling me is you've developed a machine that can tell us the speed of a reflex. So a computer report out of how fast it is, as opposed to looking at the speed. And it is definitely very, very accurate. I agree with that.
Yes. In other
All
words,
right.
for the very first time, not only can you get the patients on the right type of medication, which is very important, but you can get them on the right dosage. In other words, what I did is I took all the guessing game of how much the patient needs. This is a very definitive program. When the reflex speed comes into the normal range, they are at dose. So there's no more guessing about how much medication. And quite a few patients don't really feel optimal until they're at the right dose.
All right. Well, thank you very much for that, Dr. Turner. This segment was a wonderful segment. We've introduced the thyroid, the symptoms, and the Thyroflex machine. So that's it for now.
Thank you very much, Dr. Mann. And I'd like to talk about some other things, and we'll go to the next session now. 1, go.
All right. Well, Dr. Turner, thank you for spending some time with us to explain all of the things that you have spent so many years learning. I know that you work with all the hormones and help practitioners understand that they all matter. Why don't you talk to us about your core hormones, please?
Sure. You cannot balance the thyroid by itself. In other words, if you have a thyroid disorder, which 80% of you do, they have to be balanced in what is known as the core hormones. The core hormones are something that I developed, and we address the stress modulators. That's the DHEA, pregnenolone, and the D3K2. We address the iodide issues, and I'll explain that when we cover the iodine section. But iodine makes the medication work. We address the adrenals, because when you put the adrenal the adrenal chart next to the thyroid chart, there are 3 areas that's in pituitary, thyroid, and of course your adrenals down here that can affect the thyroid's performance. We address the sleep issues, because sleep is critically important to get balance, especially if you go into menopause. Don't forget, as I said before, thyroid controls your estrogen and your progesterone, your menstrual cycle. If you're in perimenopause or menopause, it controls your sleep. So it's very important for us to get the sleep under control, because it doesn't matter if I give you thyroid medications or other medications, sleep will interfere with the uptake of those medications. And finally, we address the CoQ10 slash ACTH. That's the signaling between the pituitary and the adrenals. So all of those have to be balanced concurrently. So it's fairly easy. We do it the old-fashioned way. After we do the thyroid we as doctors ask you the symptoms that most of you haven't been asked before, and there we have the answers in front of us. You know what's wrong with you. We're just going to clarify what areas it falls into, so we can treat you properly.
Mhm. Well, here at Wise Women Wellness, we certainly spend a lot of time testing hormone levels and getting hormones optimally balanced, or everything from thyroid to cortisol and DHEA and estrogen, progesterone, testosterone, vitamin D, and even insulin. So, yep, it all matters.
Yes.
Well, talk to us, please, about the medications that you believe are the best and what you advise for your practitioners.
If you have a thyroid issue, you have to be on 3 medications. This is a hereditary disease, right? You've inherited it from your mother or your father. You've passed it on to your children. If you have it, you have to get your children tested. And we also recommend that you bring your mother and father and your parents and your grandparents if they're still here. But the medications are very, very critical. We do use synthetic medications or allopathic medications for certain conditions like autoimmune, which I'll cover in a few minutes. But we prefer to use natural synthetic or bioidentical hormones. The basic 3 to make your thyroid work are thyroid made out of bovine or porcine, and we make both. That's got T1, T2, T3, T4, and T7 in. Don't forget that synthetic is T4 only, and the body eventually rejects it. Next one is iodine iodide. Iodine iodide, of course, does conversion of a thing called T4 into free T3 and free T4 to make the medication work. No iodine, the medication will not convert. And finally, D3K2, which opens up the receptor pathways. There's a lot of information on D3, especially with COVID right now, how it boosts your immune system, but it's also critical for opening up the receptor pathways for the thyroid and iodine to get into the mitochondria.
Okay, thank you. How about some of the autoimmune things that you've learned that you can share with us?
Sure. A certain percentage of your patients are autoimmune. Autoimmune is caused by mistreated, undertreated, or misdiagnosed hypothyroidism in a combination with lack of iodine. It triggers an autoimmune response. The main ones, or the main one that you will get, which is 18% of your patients will have Hashimoto's. Hashimoto's is caused by hypothyroidism not being addressed. The next one is Graves, which is only about 1 or 2%, which is overactive thyroid. That's more difficult for us to treat, but our treatment protocols means that we can double the effectiveness of the treatments that we use, so that you do not have to have your thyroid removed, or partial. It's called a partial ablation. Finally, we have a thing called hashitoxicosis. Now, this is 1/2 of 1%. So don't worry about it out there. Very few people have it. But for hashitoxicosis, you have both Hashimoto's and Graves, which, as you know, Dr. Mann, is quite rare on the blood tests. But for those, we do a genetic, we know there's a genetic component, and we do a genetic DNA test. The genetic DNA test tells us where the autoimmune response is, where the inflammatory response is, how your digestive responses are happening, and we're able to put hashitoxicosis into remission. For Hashimoto's, I was the one who discovered in my clinical trials, purely by accident on 2,200 people, how to not only put it into remission, but how to cure it. Now, Hashimoto's triggers an autoimmune response, and it goes not only to your thyroid, which enlarges, but it goes into your digestive system. It goes into your joint. It's called joint effusion, but all your joints, knees, everything ache, and there's a whole cascade of autoimmune responses that we do not want you to go down the path of. We have found that by simply reversing Hashimoto's, and this is not a slow thing to reverse, it takes us 1.5 to 2 years to not only reverse it, put you into remission. That the remission comes quite fast, but you have 0 and 0 and for a thing called TPO, AB, and TGAB, which is the markers. We're able to get you to absolutely 0, and we're also able to clean up the other autoimmune responses that you're suffering from. So I discovered that years ago. We're peer-reviewed, we're published, and we use it on 18% of all the patients around the world who use our protocols in 1,000 clinics. So we're talking about hundreds and hundreds of thousands of patients that we correct the quality of their life for the rest of their lives.
Mm-hmm. And
finally, I want to add in a thing called reverse T3. Not quite an autoimmune, but it's caused by your adrenals. Your adrenals make the free T3 come out back to front from too much stress. So instead of having free T3, you have 3TF. That means that as it goes through the receptor pathways, instead of it coming through there and in, it reverses and it can't get through into the mitochondria where it's got to do its work. Now, within a cell, there's quite a few mitochondria, so it's got to get into all those mitochondria, and it can't because it's back to front. And what we find is that reverse T3 is a T4 problem. The T4 keeps on going up, and it has to be addressed. Reverse T3 is a precursor to Addison's and Cushing's, which you won't be very happy to have those conditions. But I just want to summarize about the medications and core hormones and autoimmune, is that we give you back the quality of your life. You don't realize that you're missing it until we correct you. And you think there's something wrong, but quality of life for the rest of your life is very important. And that's why you have to stay on these medications, because you're missing them from birth, for your entire life, right? In fact, Dr. Mann, what's the first thing they do when a baby's born? They get it to breathe, they get oxygen into the lungs, and immediately they must do a heel kick, which is a reflex test, or a heel prick test. Now they do with a little blood test to test the thyroid hormones immediately, because the baby has to have enough thyroid hormones to survive.
Right. Well, it's pretty amazing, all the research you've done and everybody that you've helped worldwide, Dr. Turner. It's very, very impressive. So thank you very much for that segment. And I'll say goodbye for now.
Thank you. 5, 4, 3, 2, 1.
All right, well, hello again, Dr. Turner. Let's continue on our discussion about thyroid and the ThyroFlex machine and iodine and some of the other cool things that you discovered and want to share with us. Let's talk about iodine next. Tell us what you know.
Oh, iodine is so important. First of all, no one is allergic to iodine. No one. Even if they tell you I have a reaction to iodine or seafood, no one, it's an element. Every single cell in your body needs and requires iodine. Did you know that 98% of everyone in America is iodine deficient? In fact, through the central part of America, you have a thing called the goiter belt, because there's not enough iodine in the food supply. But iodine is so important that it converts your T4 into T3 made by the thyroid by knocking an ion off the T. So there are 4 ions on top of the T4, and it's got to have 3 ions to go to T3. I2, which is the iodine, knocks one of those ions off. Now you have to have the right combination of iodine. You've got to have iodine and iodide that was actually created by a person by the name of Dr. Lugol's back in 1863. He got it right? The exact ratio of iodine to iodide. But number one, it converts the medication you've got to take and the T3, T4 that your thyroid makes into usable form. In other words, the body cannot use TSH, it cannot use T3, and it cannot use 4. The only thing that it can use is free T3, free T4, and you need iodine to get that. But there are some bonus things to iodine besides making the thyroid work. Let's talk about the breasts, or breasts, ovaries, uterus, and for men, prostate. So the iodine is the main surveillance system in your body in adequate doses to stop you from getting a hormone-driven cancer. Very important word, hormone-driven cancer. In other words, if you have any lumps in your breast, any lumps, hot spots, denseness, or cysts, iodine, if we give you high-dose iodine, there's an 87% chance that we will reverse them, depending on how long they've been there, right? Because that's the things that turn into will eventually turn cancerous. It takes 7 years from the time you get your first cyst for it to there's a high probability that it will turn cancerous if you do not address it. The same for your ovaries. Cysts on your ovaries. In fact, I was working on that this morning. I'm just working on some new research on that this morning on the ovaries and uterus. But cysts on your ovaries is caused by low iodine, right? Endometriosis, thickening of the uterine lining, or the cysts, such as the Bartholomew cyst in your uterus, is caused by low iodine. I hear of so many women having to have the uterus scraped because every time you get your menstrual cycle, iodine sheds cleanly all the lining from premenstruation off the inside of the uterus. If it's not shed off, it leaves cells behind, and they eventually build up the thickness of the uterine lining and or cause cysts. So iodine is vitally important for our female patients, not only for the breast, ovaries, but for the uterus to stay clean and have no thickening of the uterine lining. Finally, for you men out there, right, we might as well include you in prostate enlargement, right? I'm an old man. I born in the 1940s, and I have zero trouble with my prostate because I take adequate amounts of iodine every day. It stops the enlargement. It can also, if you're starting to get enlargement, the prostate has also, you have an 87% chance of shrinking that down with iodine and a few other things, but iodine is the main thing to not only shrink it down, but to keep it in check. So what are the symptoms, right? How do you know if you have iodine deficiency? If you poke your tongue out, you can see teeth scallops along the side of your tongue. And that means your tongue has enlarged. You're not supposed to have teeth scallops along the side of your tongue. And the tongue increases in thickness. Some people complain about their tongue's too big for their mouth, or they keep on biting their tongue. That's a definitive sign of iodine deficiency. I don't have it, but there are two parallel lines around your neck. I can't see it on you there, Dr. Mann, but there are two parallel lines around the neck. Everyone thinks, and they come from all the way here and they come all the way around, 1, 2. That's a goiter. In other words, a lot of people think that they got it because of those lines from age. It is not age, it's from iodine and deficiency. And of course, the next one is puffiness. Puffy face, puffy hands, puffy feet, a bit of water retention. That's all from iodine deficiency. But remember this, I just want to summarize this. It is the main surveillance system for hormone-driven cancer. Now, the majority of cancers in the world are hormone-driven, right? Especially with prostate, number 1. Number 2 is breast, right? And that is why iodine is vitally important for every single cell in your body. It is a surveillance system.
Very good. Well, thank you very much, Dr. Turner. That's very interesting. All right. Well, thank you for this section. We'll continue on. Well, Dr. Turner, thank you for all the information you've shared so far. Let's move on and talk about our adrenal glands and the hormone called cortisol.
Okay, sure. Cortisol plays a major role in thyroid's function. So when we balance your thyroid, we definitely have to look at your adrenals. The adrenals make quite a few different hormones that I won't go into too many details here, but there's a whole cascade of hormones that are triggered by the adrenals. But we'll just talk about one today called cortisol. Cortisol, at the far end of cortisol triggers your sleep, right? So for you to get adequate sleep, your cortisol's got to be balanced. But some of the symptoms of cortisol is bad digestion, right? Rapid heartbeat, exhaustion. Between 2 and 4 p.m., if your cortisol's low, you run out of energy. You want to sleep. You want to have a pick-me-up like tea or coffee or something sweet or something salty. And of course, if you drop straight to sleep at night, instead of going through the melatonin, instead of going through the tryptophan, serotonin, then melatonin hormone response to get you to sleep, which are 15 minutes apart, then if you drop straight to sleep, you are adrenally exhausted. So, and if you have extreme fatigue, you end up and you're constantly exhausted and tired all the time, and you push yourself, you push your lipids up, and your blood sugars up. So instead of using your reserves of cortisol to keep you going until bedtime, you go into a thing called reverse T3. We spoke about that a few minutes ago, but that means that the adrenal cortisol is actually affecting the conversion of T4 into a thing called free T3. It converts back to front. We like to do a saliva test. I'm not quite sure if you do the saliva test at that stage, but if a patient has reverse T3, we do quite often recommend a saliva test, because the saliva test, and we check for a little hump on the back of the neck, little fatty hump here, because that is the precursor, or that hump is actually indicative of two disorders. One is called Addison's, and one is called Cushing's. One is hyper and one is hypo. But that is where you're going into a mental and nervous breakdown, which you do not want to go there. So the adrenals play a major trick on your thyroid. It affects your thyroid if you put the thyroid axis and the adrenal axis side by side. It affects it at the pituitary, the hypothalamus, and the thyroid. So there's three different areas that the incoming signals from which occur on the adrenals sit on top of your kidneys, and they can affect it in three different areas. So you have to have the stress hormones balance. In other words, they can stop your thyroid from working. It's very easy for us to treat once we've identified to treat either reverse T3. It only takes us 30 days to get you out of that. But which is the reverse T3 is done by blood test. But but we treat it with hormones. We actually have hypothalamus hormones, pituitary hormones, and a thing called adrenal hormones. Two lots of adrenal hormones, one from a thing called the adrenal medulla and the adrenal cortex, that actually effectively reverses the slowdown in the reserves of your cortisol. Think of a glass. If your glass is half full, right? In fact, I have a glass here of water. If it's half, it's supposed to fill up to the top every night. And you're supposed to use from here to here, and from here to here. This is called flight or fight reserve, right? If you start halfway down, you're adrenally exhausted. That's how we pick up on a saliva test. Use from here, and by 2 to 4 p.m., you run out. You run out of cortisol. So your body turns around and said, okay, give me some energy. I mean, this person won't put me to bed, or I can't lie down and have a sleep. So, as I said before, a few minutes ago, it turns on your lipids. And where do they go? That's going to go into your arterial walls, right? So it's pushing you towards stroke and heart attack, and turns on your blood sugars, because that's your next two energy sources. It chunks out little blocks of sugar, right? And if it keeps on shutting them out every single day, you're going to exhaust your pancreas, right? And that is going to push you towards diabetes. So getting the adrenals right, not only for the thyroid state, but for your heart and for your diabetic or pre-diabetic state, is very, very important. Quite often I look at a blood test and straight away I see the A1C, that's a long-term blood sugar marker, and the lipid panel is up, which, as you know, there are quite a few different lipid measurements. And I know that they're eating right and they're doing everything right, but it is caused by the adrenals.
Very fascinating, Dr. Turner. And I think that's very confusing for women sometimes. So it's good to be able to put all of that information together for them. All right. Thank you. That was wonderful.
Thank you. And it's a pleasure discussing all these things with you and helping people.